Niger State Ministry of Secondary and Tertiary Health, in collaboration with the Leprosy Mission Nigeria, has flagged off free National Tuberculosis Children Week to address rising cases of pediatric tuberculosis that can lead to child mortality. Favor Obasi reported that the event flagged off at Idris Kuta Oud Airport Primary Health Care Minna, with distribution of testing tools to various local governments in the state.
While flagging off the free tuberculosis testing week for children across the state, the Permanent Secretary, Ministry of Secondary and Tertiary Health, Dr. Abdullahi Imam, noted the importance of identifying high-risk children that have tuberculosis and getting them treated, as pediatric testing in the state is very low.
Great pleasure to welcome you to this event and to thank you most sincerely for finding time to come. Like all that have been said, TB, it's easy to think that TB only occurs in adults, but TB in children is usually a disaster because children are supposed to be the future of every generation and every community. So if you can take care of TB, not only in adults but in all children, I think it's very, very important. And from what the Director of Public Health said, 9% of all burden rests with this group of people. And again, because of what the expert here, the pediatrician said, Dr. Aisha said, it's very, very difficult to diagnose TB in children. Therefore, you have to have what we usually say a very high index of suspicion before you can pick TB in children. When you can pick it, it's already too late. When you can easily pick it, it's already too late. And therefore, it's no surprise that the nation, through our policies and policymakers, have dedicated today and for the whole week a day and a week set aside to deliberately demand the generation of these cases from the facilities and the communities.
In their separate remarks, the Director of Public Health, Ministry of Secondary and Tertiary Health, Dr. Idris Ibrahim, and the State Program Officer of Tuberculosis and Leprosy Program, Ibrahim Isa Eba, highlighted that the week is set aside to change the narrative of focusing on free adult testing to children as they are the leaders of tomorrow, with the intervention from the government and partners to follow them to their houses, schools, and places of worship.
Today we are here to flag off the National Childhood TB Testing Week for 2025. We know the essence, the importance of this week. We are aware that pediatric testing has been very low in Niger State, and for the past few years we have put more emphasis on the adult tuberculosis. So we want the narration to change. We want to focus a little more on children because we know the children are the leaders of tomorrow. We want to be able to get them tested, and those that are positive, put them on treatment. So this week essentially is to be able to identify all high-risk children that have tuberculosis, so that we can be able to put them on treatment. We also this week also for us to be able to increase sensitization and awareness concerning TB as a whole.
It's a day of joy that the children are left behind in terms of TB diagnosis, and the ministry, the government, and the partners take it up that all these children should be followed to their houses, to the orphanage homes, to whatsoever they are, Islamic school, churches, so that we can get them tested. Because some of them, when they come to hospital, they will tell you the whole history about what a child is all about. So there are some hidden cases at home. Some of them go to the traditional herbalists. Some of them, they have been hijacked at home not to go to hospital because of the ignorance. So this time around, the government has taken it upon themselves and the partners that we should enter any angle in Niger to ensure that all these children are being tested and we should be able to identify some of these diseases. We are not even doing TB alone. We are going beyond TB because our machines that we have go beyond TB investigation. We either go for pneumonia or asthma. So with all this equipment we have today, and also the permission given by the government, we want to assure you that all the children in Niger State almost will be tested. And by the grace of God, we hope to help those children that are sick on bed or at home to get treatment for TB.
They then called on parents to comply with the healthcare service providers during this week to get their children tested and avoid taking them to herbalists or using traditional medicine when they are infected with cough symptoms. Favor Obasi, reporting for NSTV News.